Hello, Philip Jeffrey here. Just to recap, I have multiple myeloma. I've had it for a while, and from February 2013 until November 2013, I was on Velcade chemo treatment, went to the hospital every week for injections in my stomach, as well as various pills I would take, crazy side effects I had, which I've detailed on my blog, fadetoplay.com. And since mid-November, I've been off chemo. I've been doing pretty much monthly blood tests, and a little over 24 hours ago, I went to see my cancer specialist to get a feel for how how what my results mean um, since I had my blood test last week, and I saw him in December based on November's blood test just to get sort of like um, for to talk to him and say how you doing, what's going on, what's happening in your world. I was still feeling pretty brutal after finishing chemo because this chemo was really bad. And since that time, for the what, January, February, March, three blood tests, I have four blood tests I've had since ending chemo. I found that my IgG, which I thought was my cancer levels, have been increasing. So IgG is actually your good protein, your bad protein combined together, and I was like, okay, this is sort of like expected. Not being on chemo, obviously, I'm gonna have increase in cancer. And I just hope that the level is sort of like that it moves slow and not so like rapid increase in cancer, need chemo tomorrow type thing. And it was also a type of learned helplessness. I felt that regardless of how I live my life, what I do, that my cancer levels will increase, and that there's really nothing I can do except be on treatment. So treatment means cancer levels stay the same or lower. No treatment equals cancer levels go up. And there was only one period in my sort of like life of having cancer when without being on treatment, that my cancer levels had gone down, and this is sort of relevant when I was part of the Jay McGonigal Super Better program back in February 2012. It was a way to sort of like use to create a goal that allows you to improve your health, become healthy through achieving various goals. At the time, I decided to take photography and make that my goal, where I would take pictures every day, and by taking pictures every day, it would help me in a sense not so much focus on my cancer, but use the power of photography to hopefully heal me and make living with cancer not this negative sort of case. And what was really cool is that in in May, when I went to my specialist, my cancer levels actually gone down. I was like, whoa, how did this happen? My specialist was like, whoa, how did this happen? I'm like, I know, it's super better. That's how. And that was sort of like a little happy thing, highlight of how a part of my life where doing something that created this sort of like power within me of empowerment of using something I like to make it part of my life had a positive effect on my health. And eventually my levels went back up, etc. Went back on chemo. However, that's sort of relevant for now. What I've, like I stated, what I believed is that my cancer levels have been going up the last few months. But what's been happening, my cancer levels have actually been going down. So since I finished chemo in November, my cancer levels have been going down, and I was just really surprised when I went to my specialist. I'm like, okay, my IgG is 8.9. I wish it was hadn't gone up so much. He's like, Philip, what are you talking about? Your cancer levels have gone down. I'm like, no, IgG is here. It says 8.9, and he's like, no, no, you are a complicated case. In my case, the M spike is what most people look at for multiple myeloma, but my M spike doesn't work. It doesn't show this sort of like cancer levels. And so for me, it's a conglomerate of things with IgG in conjunction with my IgM and IgA. Again, IgG being the good protein, the bad protein mixed together, and 8.9 is good because generally without cancer, like your IgG is probably in the teens. So, oh, I am in the normal range. This is good. As well, what we're looking at is my IgA and my IgM. And if we look at IgM from, say, November, my IgA was 0.14. My IgM was 0.10. My IgM in January, 0.17. In IgM, 0.33. Getting to now, so February 6th, IgA 0.24, IgM 0.38. Last week, IgA 0.31, IgM 0.33. So between February and March, my IgA and my IgM have increased. You're like, whoa, that doesn't sound good. This is IgAM thing increasing. But no, that means that the healthy cells are increasing and the cancer cells are decreasing. So higher IgA, higher IgM is good. So this is like good news. I'm in remission, and it means that in a sense my cancer is there, out there. It's in my body because again, remission doesn't mean a cure. But my cancer level is like low. It's like my cancer's playing hide and seek, and I really don't want to run and find it, so I'm gonna let it play hide and seek and run off and hide. And then someday I'm gonna be walking down the street and I'm gonna I don't know, bump into my cancer. My levels are gonna be increasing again. But until I find the cancer, so I'm not looking for it, I'm just gonna go around, in a sense, doing what I've been doing since mid-November that have allowed my cancer levels to continue to lower and my healthy cells to increase. And that means just continue to focus on photography being part of my life and using that as a goal to sort of share my life through photography, whether it's taking self-portraits, whether it's just capturing everyday objects. I find that photography has a healing process to me. It makes me happy, keeps me excited, gets me out beyond my room, helping me discover my world. And I just love taking pictures. So that's what I'm going to be focusing on for the next while. In a sense, if what you're doing in life is keeping your cancer levels low and your healthy cells going higher, then keep doing it, because how does that not make sense? So that's what's sort of going on in my life right now. I'm just really happy that my cancer is just not there right now, that it's in remission, and this is sort of the opportunity to be happy, to focus on doing less stressful things, and to find what I enjoy doing and continue to do it, to sort of make the period between chemos as long as possible, because I don't want to be stressed out on things where chemo comes now. I want to push chemo off into far away future. So I'm just really happy right now. I'm glad, again, that sort of deals with the idea of how you sort of there's sort of two ways of looking at being patient. Asking questions is key. Had I not asked questions, had I just gone in and said, oh yeah, whatever you say, doctor, life is good, I'm just reading this wrong. But no, I'm explains to me, because my understanding of what I'm looking at cancer levels was incorrect, and now I have a good understanding of it. I'm going to spend time, because one of the sort of also benefits of things I've found since I've sort of this last year and a half I've been focusing on my health, is I'm spending much more time being on healthcare chat groups. I'm spending much more time looking at different sort of technology, thinking how that can relate to cancer, trying to understand more what multiple myeloma is, attending different talks on stroke or whatever, sort of get a holistic picture of not only my health, but trying to understand how I, as a patient, can help other people understand how patients fit into the healthcare role, patients fit into the drug treatment role. Patients, in a sense, have a voice, and they can help with different sort of factors. So that's sort of what I'm trying to focus on for the future, as I'm just trying to, in a sense, stay healthy, stay happy, and just live a cool, sort of fun, positive life without thinking of the negativity of chemo being right around the corner. So that's my little message, people. If you have something you love, me, I love photography, just stick with it. and hopefully that what you do will help you with whatever sort of like negative things may be happening within your world. Bye bye. I'll keep everyone posted, and have a great day.